Let's be real. We all want a fair shot at a healthy life. But is our society actually set up to deliver that? It's a massive question, and it turns out there are specific tools designed to answer it. But the real issue is, are those tools any good? And make no mistake, the stakes here are incredibly high. This isn't just some academic debate. The World Health Organization itself is calling for us to check the fairness of pretty much every major policy decision, from huge global trade deals to the laws that govern our own neighborhoods. So, where do we even begin? Well, before we can start measuring fairness or equity, we've got to be crystal clear on what we're actually talking about, because the words we use, they really matter. Okay, first up is a term you've probably heard before: health inequality. At its heart, this is a pretty straightforward idea. It's simply about observing differences in health between groups of people. It's a fact, something you can measure. But here's where it gets really interesting and really important: health inequity. See, these aren't just random differences. These are the differences that are avoidable, that are fundamentally unfair, and that come from how our society is structured. This is where we shift from just looking at data to asking questions about justice. And this right here, this lays it out perfectly. An inequality is just a difference. Like outdoor workers getting more sun exposure, which leads to higher rates of skin cancer. But an inequity, that's an unfair difference. Like a whole community suffering from higher asthma rates just because they happen to live next to a polluting factory. One's a statistic. The other is a genuine injustice. So how do governments and health organizations try to get ahead of these things, predict these impacts before a new policy or project gets the green light? Well, the main tool in their toolbox is called the Health Impact Assessment, or HIA for short. All right, so we have this tool, the HIA. It sounds good on paper, but is it really up to the massive task of measuring something as complicated and thorny as fairness? That is the exact question a group of international researchers decided to dig into. They asked a really simple but profound question. Are our current HIAs actually good enough to grapple with health equity, not just measuring the differences, but really getting at the fairness, the justice, and the root causes of why some groups are unfairly burdened? And to find out, they did their homework. They went deep. They combed through all the existing research, they sat down with the world's top experts, and they held workshops with the very people who are out there in the field doing these assessments every single day. So after all that digging, what did they find? Well, it didn't take long to see that the standard tool we've all been relying on, it's got some pretty serious cracks in it, especially when you try to use it to measure equity. So problem number one is a language problem. The researchers found that nobody could seem to agree on what equity or inequity even means in practice. People were using the same words but talking about totally different things. It's like trying to build a house when your partner's using inches and you're using centimeters. It's just not going to work. Then there's the second flaw, and it's a huge one: a massive blind spot. The current tools are just not good at looking at what some people call the causes of the causes. The deep-seated issues like how power, money, and resources are spread out in a society. They're great at looking at the symptoms, but they totally miss the underlying disease. And this brings us to problem number 3. Think of it like this. These assessments are much better at looking downstream, at the immediate, obvious effects of something. They're not so great at going upstream to figure out which fundamental policies are actually poisoning the river in the first place. So you see, even when people want to do the right thing, they're often up against some huge barriers. They might not have the right data. How can you assess if a new transit line helps people get to the doctor if you don't even know who in that neighborhood has a car? Or maybe their findings are politically inconvenient and just get ignored. And let's be honest, when you're on a tight deadline, it's really easy for this whole crucial process to just become another box to tick. So with all these problems, a muddled language, a blind spot for power, a focus on the easy stuff, what did the researchers decide? What's the final verdict on the health impact assessment? You might think the answer is obvious, but it might just surprise you. The logical conclusion seems pretty clear, right? Just scrap the whole thing. Is it time to throw out the HIA and design a brand new tool from the ground up, one built specifically to measure health equity? The answer from the researchers, after all that work, was a very clear, very simple no. Turns out, the basic framework, the core idea behind the health impact assessment is actually solid. The foundation is good. We don't need to reinvent the wheel. We just need to give the one we have a serious upgrade. All right, so if we're not starting over,
what do these upgrades actually look like? Well, the researchers didn't just point out all the problems, they gave us a blueprint for how to fix them.
Here are the 4 key upgrades they're calling for. First, start analyzing power and politics head-on. Ask the tough questions. Who really benefits from this policy and whose voice is being left out? Second, standardize the language. Get everyone to agree on the definitions so that an expert in Brazil and an expert in Canada are actually talking about the same thing. Third, we've got to develop new ways to look upstream, to trace the long-term effects of things like history and social structures. And finally, number 4, build up the skills and resources needed to do this complex work and do it well all around the globe.
In the end, this is about so much more than just a specific tool. It's about a fundamental recognition that the choices we make as a society, the rules we decide to live by, have real life-or-death consequences for people's health. And that leaves all of us with a pretty big question to think about. Are we building a world that is simply full of differences, or are we actively building one that is fundamentally unfair?